If you think back to high school science class, what do you remember your teacher telling you was the most important system in the human body? The number one answer, guaranteed, is not even a system. People tell you the heart. We have been driven in society to believe that the heart is the most important part of human functioning. And I'll say, you're right. That's probably what your teacher taught you. Can I ask you a few more questions? What's in here? And I point to the skull and they say, my brain. And then I ask, what does your brain control? Number one answer, everything. My job as a chiropractor has always been to help you understand how the brain communicates those messages to the rest of your body.
The spine and the nervous system is so connected to our ability to function and therefore be healthy and therefore be happy. And so in a world where it's a very quick fix, pill popping world, chiropractic brings an opportunity for people to get well without the use of drugs or surgery and to stay well. Chiropractic didn't dream up, make up, or create this relationship between the spine and the central nervous system. In 1895, a guy just created a vehicle by witnessing what happened when he started to gently adjust vertebra into place, and he would start to see changes, and people would fly all over the world to say, wow, this guy was healing from heart problems, so all the heart people would come in, but not everybody with heart problems got better, and not everybody that couldn't hear got their hearing restored. And it turns out that this developed the science behind what was occurring, and what really occurs is that spine has such an intimate relationship with the spinal cord and your central nervous system and your brain that if neglected and not taken care of throughout life, just like you take care of your car, just like you take care of your teeth, just like you take care of your nutrition, that your spine is such an important part of health that must be addressed. Chiropractors are the ones that look at, evaluate, and address this connection between your spine and your central nervous system. So chiropractic is nothing more than a vehicle to address this major stress component we have in health.
What is subluxation? Well, I do talk about subluxation in my practice. Basically, when I talk about subluxation, I tell them that it's an interference within the nervous system or the communication system of the body that's preventing the brain from talking to the body, basically.
So a subluxation is basically a misalignment in the spine. Each vertebrae is a joint. They're supposed to move like this, and sometimes they get stuck. When they get stuck, it can put tension on the muscles and the nerves that come out of the spine area. And so when that happens, you'll find different issues in the body occurring, whether it be pain or headaches, numbness, tingling, or sometimes babies present with colic or reflux or ear infections. And so if we can correct those subluxations, the body will respond accordingly, and then you'll ultimately feel better and be healthier.
I don't think there's one thing in particular that's going to cause it, because it's never one thing. People always come in and they ask me, Dr. Melissa, what caused this? It's like sometimes there's an obvious reason. Somebody's had a blunt force trauma, car accidents, fall down the stairs, football, soccer, any type of athletic endeavor that's contact sport.
Think of it like an internet connection. If I'm on the internet by myself, everything's kind of really quick and I can stream everything. But if a whole bunch of other people get on, they suck some of the information away and the internet runs a lot slower now, right? So that's essentially what a subluxation does, is it makes the system run a little bit slower so my downloads don't happen as fast. I might have buffering on my video that I'm watching, which in the brain's way of looking at things is I might be forgetting some things, or I might not have good balance, or I might have brain fog is another kind of key thing. And that usually comes from the brain not getting enough fuel, not getting enough activation. So the chiropractic adjustment is a way to turn the brain up or turn the brain on.
The whole idea of resolving spinal degeneration or taking that approach and raising that awareness is at a critical time. People need to know this message because now we're seeing changes in the children's spine that we didn't see in the adults 10, 15 years ago.
The real problem is whether or not they are ever educated that something like a functional medicine approach is even an option. So many times they end up in my office after 8 or 10 years of doing this, and they say, this is what I thought I was looking for in the beginning, but I thought nobody did it. I kept asking, I kept looking, And I kept running into the same prescriptive answers over and over again everywhere I went. I didn't know people like you existed.
Chiropractic is an amazing field that has the potential to make global changes in the body. And what continues to amaze me is that more and more, the things that we've been talking about for over 100 years are starting to be supported in the research literature.
I see a shift, right? I see people coming to us as almost a first line of defense. Once they get some kind of diagnosis, they're coming in to see us. I even see younger kids who have not been diagnosed, parents coming to us saying, we are concerned about our child's behavior and we want to do something proactive. So I see a huge shift in, instead of people just saying, I'm just going to wait for a diagnosis and then do something, I see people being much more proactive.
You can be empowered through education to make the best choice for you and your family and be educated about it instead of just being told how it is. That's one of the best things I think a person could do, especially to go to talk to a chiropractor, is just open your mind a little bit and get out of the box that I feel like they're trying to put us into with healthcare.
We need to realize that we are the first generation in history that is getting the advance notice that whether we like it or not, want to or not, we will probably live longer than we ever thought. So if our generation wants to get there in style, with health and vitality, then we have to think differently. We need to look at the world differently. We need to make healthcare choices differently. Not just crisis care, but lifestyle care. And making the health of our spine and nervous system and healthy lifestyle choices has got to be a priority in this shift.
I don't want to hear the statement anymore, why didn't anybody tell me? I, as one person, I can't tell everybody. I do the best that I can to teach as many people as I can about this chiropractic paradigm of health and healing, but I depend on a troop of ambassadors, if you like. Once you know, don't keep it to yourself. Tell everybody. Let's create a healthier planet together. It's not a one-person job. It's going to take efforts from everybody.
Every parent wants their child to be healthy. So the best thing they can do is to make sure that their whole body is healthy. And one of those aspects is chiropractic care, right when they're born. You want to give them a healthy start to life. And so we can do that by taking them into their local pediatric chiropractor, getting them evaluated, and then getting them adjusted if needed. Pediatric chiropractic is totally different from adult chiropractic. We take a very, very gentle approach. We use as much pressure as you would test a ripe tomato, and you basically just hold the segment until you feel it sort of shift into place. There's no twisting, popping, or pulling, and most kids really love going to the chiropractor.
When these children get adjusted, you could almost feel them relax in your hands. And what ends up happening is ear infections start going down. So they're on less antibiotics as they grow up, less colic happening. And then usually as they get older, they start living better quality lives based on their spine being in better alignment. And also what we've started to see, now that I've been doing this for almost 10 years, we have kids coming in who started when they were 5 years old, and now they're almost 15 years old. And the level that we see their spine compared to the 15-year-olds that start with us when they're 15 is completely different.
They're not even gonna know that they're getting adjusted, and they're just gonna be laughing and giggling, and we have I just think about last night, all these kids running around the practice, and they're just like fighting to who wants to go first, because it's such a pleasurable experience for them.
Nobody asks, do you see a dentist? There's a reason that nobody asks that, and that was patient education over decades by an industry that was moving away from treating illness towards prevention. Chiropractic's a few decades behind that in educating our consumer or patient in and around spinal decay and degeneration. We all know that we should be brushing our teeth on a regular basis, see a dental provider on a regular basis to prevent and maintain any kind of oral disease. You could see your teeth. People understand, if your grill is jacked up, we know it. You can't see your spine. The next step is to get them to take action and go to a professional who could actually peek in and see how their spine nerve system is functioning.
That's why you go to the dentist all the time as a kid. You go twice a year. Let's keep your teeth as strong as possible. The less amount of cavities, the better, so that you have instead of having a mouthful of fillings, you have a mouthful of teeth, right? So it's the same thing with the spine. We want to have a spine filled with beautiful curves and great movement, and then that spine is a healthier spine and less vulnerable to injury as they get older.
So every 6 months, we go to the dentist for a routine checkup. And it's the same thing with chiropractic. What happens is different falls and slips and accidents and injuries that we take throughout our life will cause that body to misalign, right? We call it a subluxation within chiropractic. Those bones will misalign. And if they're out of place then at that time period, your body does what it needs to do to make the area more stable. And that's early stages of arthritis, right? So I equate subluxations in our practice or misalignments in our practice to cavities. Right? You would never walk into the dentist and tell the dentist, I've got cavities, doc, but don't worry. It's the fact of the matter is I'm old, or it's just the fact that my parents had it. But people do it all the time with arthritis.
And so we need to get people to better understand you got to take care of your spine just like you would your teeth, just like you go to the exercise, just like we do with our muscles and our cardiovascular system and our cars and other aspects of human health and even life, style.
When you have somebody that's in the medical model actually looking at a patient with an x-ray who's got all this degeneration, they always say what? Well, it's just because you got old. It's just the natural process of aging. But if that's the case, then why is it there's 70, 80, 90, 100-year-olds without any degeneration at all that have a curve in their neck?
If I, at almost 64, feel like I'm, in my mid-40s at best and can perform at a high level in pretty much anything and everything that I do, I start telling people, they say, oh, you look good for almost 64. I said, guess what? That's what almost 64 is supposed to look like. This is the normal. What we see in people that haven't lived that level of lifestyle, they look so much older than their age. And so the people in the general public have now assumed that a 65-year-old is supposed to look old, when in fact, they're supposed to look like they're 65 and still vibrant, not look like they're 95. One of my colleagues adopted this byline called the 100-year lifestyle. What decisions would you make today if you knew you were going to live to be 100?
It is not old's fault. Stop blaming old for the challenges that you may be having. It's so funny. We see people all the time in our practice where you'll see a 30-year-old that says, oh, I'm so old. And you'll see an 80-year-old that's like, man, I feel great. It has nothing to do with age. It has to do with your choices, your responsibility, how you take care of yourself. Are you sitting on the couch 24/7 playing games? Or you're up moving around? Are you taking care of yourself? Are you getting adjusted? Are you adjusting your lifestyle? This is so important if you want to not be at risk for yourself. And listen, there's a lot of parents who are raising neurologically damaged kids who are becoming neurologically damaged. Well, who's going to take care of you if you're raising neurologically damaged kids? It's a longevity crisis that we have in this country.
When I was in school, we were taught the brain is the brain is the brain. So the brain, pretty much by the time you're 6 years old, is done growing, no more new neurons, and you start losing cells and losing until you die. And neuroplasticity has come up in the last 20 years or so to say that the brain is constantly regrowing new areas, especially certain areas. I like talking about it like a traffic jam. So if there's a traffic jam somewhere in the brain or the spine or nerve system, now instead of the information just going up into that particular area and then being shuttled to whatever area it has to go, it has to take a different route. And the more circuitous that route, then the more processing problem the child has. So if we can teach these kids through chiropractic, through functional neurology, and through a better diet, we can allow their nervous system to work better. It's kind of like we clear the traffic jam.
You may think you're too old to change. You may think that your kids have too many habits and they can't change. That's not true. It doesn't matter how you got here if you're willing to change and find new healthcare leadership with many of the doctors and the providers, the chiropractors that are behind this cause.
The other thing that contributes to subluxation is toxins. And it's only recently become a regular conversation or a topic of conversation in today's world. We have the GMOs, we have Monsanto with Roundup on so many products that causes leaking gut, the pollution in the air that we breathe every day. Whatever we're taking into our body has to process, it has to deal with, and it has to assimilate into our body. So toxins can cause things like inflammation, which lead to things like autoimmune disorders, and basic dis-ease and disharmony in the body and dysfunctions.
There's a lot of threats to kids these days. There's a lot of toxins, and I talk about this all the time. It's starting from when mom is pregnant, even before she got pregnant. She maybe wasn't eating the high quality foods that she needed. She wasn't taking vitamins, or she was using products that had a lot of toxins. Then she conceives and she's using that same stuff during pregnancy. Maybe she's a little bit better, but still then they go through the birth process where you're pumped full of medication and antibiotics, and then they come out and babies are given all this stuff at birth that maybe they don't need right away. And so when you're giving a little body foreign stuff, they really can't, function optimally. If you just let them be and you give them what they need, breast milk and being with their mom right away, they usually will do much better and have a healthy start to life.
Sit at an airport, sit in a doctor's office, sit anywhere where children are waiting, and watch what they do. They're either laying on their stomach with an iPad or an iPhone, or they're like this. And the prevalence of what we refer to as a text neck. And your head weighs 8 to 10 pounds, hard to believe. It would be like holding a large bowling ball, for example. You can hold it here, and you could probably hold it here for 5, 10, 15, 20 minutes, depending on your strength, maybe even longer. But even if you're really, really strong, how long could you hold a bowling ball out here? Depends on the level of your strength, but it's not long. It's probably 10% or less of how long you could hold it when you were here. So the same thing is happening when you get a reverse cervical curvature. When the curvature is reversed over a long period of time, it now leads to degeneration.
And so now what we're seeing is so many of our kids are having health disorders as it relates to decreased activity, lower spinal tone, and too much audio-visual input, if you will. We're being addicted, and people don't like that because they don't want to think they are. But if you're checking your cell phone multiple times throughout the day, if it's on your nightstand throughout the day, if you're checking it all the time, there's an addiction going on there. And right now, internet addiction in the United States rivals that of gambling.
Spinal degeneration is very interesting because when people think of that, they think about what's on the inside deteriorating, and you got to see it on an x-ray. The reality of it is you can see it in every child that is staring at their phone. You can see it in every person sitting at a desk. You can see it in people very clearly when you say, "Hey, Mary, turn around," and they go like this because they can't move their neck.
So I see degeneration all the time, and it's always in people that have a reversed neck curve, which is a product of what we call forward head posture. How many people do we see walking around like this every day? Like, look around you. It's all the time.
What wasn't around 15 years ago when I opened my practice was the iPhone. But now every single kid is on a phone and they're looking down, and there's all this extra weight of their head going towards the front of their spine, and it's causing so much more extra force to that area, which leads to degeneration.
And they're starting to do research about what effect is that having on the brain. Well, they've already shown, and it's kind of accepted, that yes, it changes kind of how your motor response patterns are, but then it goes deeper than that. It's, okay, well, that's starting to impact cognition. It's starting to impact depression. So in just changing your posture, so just, sitting up straight, even taking your phone from down here to up here, and kind of bringing your shoulders back like your mom told you to. It's been shown to change memory. It's been shown to change mood. They even relate it to kind of a stress resilience. So if you'll just change your posture, it really helps with even your resilience to a stressful situation.
The chronic sitting and the chronic usage of phones that's going on in today's world, and the copious amounts of stress that people are under in today's world, I think is going to take people out earlier. Listen, computers aren't going away, phones aren't going away, and sitting down isn't going away. And we have to do those things in order to live our life. And that's understood. So how do we combat that? We do that by utilizing things like chiropractic services from chiropractors who will take care of the spine, give specific spinal adjustments, have a great exam on the client so they can figure out exactly what's going on in that person, and then give great treatment recommendations. We just need to know that we need to do more to take care of ourselves than our parents did. And we've got to take better, more proactive measures than what they were doing as well, because our parents' generation were not sitting down for 8 to 10 hours a day. They were not in front of computers all day, and they were in front of phones all day. And so they didn't have to do as much.
Imagine what the world would be like if people, the general population, understood what people like me understand. Imagine what the healthcare would be like, or what the health of individuals would be like, if they started living what we refer to as a wellness/a chiropractic lifestyle. I think the answer is very, very simple.
What does the world look like if everybody was under chiropractic care? I would say the world looks like utopia. I know utopia doesn't exist, and that's because not everybody's under chiropractic care. But the reality is that when people are connected to self, when their brain is communicating with the body and the body can do what it was meant to do, which is survive and thrive, then everybody would be surviving and thriving. We wouldn't have the chronic disease states that we have today. We wouldn't have a dominance and a dependence on an outside source to manage the health when we're designed to manage our own health from the inside out. I think that there'd be a lot less depression. There'd be a lot less sadness. I think we'd have even more connectivity amongst ourselves, not just within ourselves, but with other people, because when you go see a chiropractor, they are touching you. There's that human connection. We need to be touched. We need to be fulfilled in that way. We need people. And so I think that that can help bridge the gap. Like, there's people out there, like especially elderly populations, that don't ever get touched. They never get hugged. It could change their quality of life immensely. Even babies that fail to thrive or that get sick a lot. Imagine if they could actually rely on the health of their own body to overcome it instead of what somebody thinks they need to inject into their body to try to make them healthier.
When everybody's under chiropractic care, which is definitely going to happen under my watch as long as I'm alive, what's going to happen is it's going to be a great world. And people are going to just be living better quality of lives. Once people start taking better proactive measures towards their health, we're getting rid of subluxation, we're starting to clear out the spine, and it's going to allow people to really just enjoy their life, enjoy time with their friends, their family, enjoy their careers. And, you know, chiropractic is a great thing. And it's a great way to live life. And it's a great way to be subluxation free and have, you know, the nerves flowing at 100% and the brain super healthy, and it's amazing. But what it leads to is it leads to a better quality of life overall, because you start to make better decisions about yourself.
We start to get over our depression, stop getting medicated for things like ADHD and dulling our society down and dulling all of our feelings down, but really embracing our feelings, embracing our emotions, growing together as a society, growing back together as a society. And I think we can really, you know, create super things and create a superhuman society in the future. And you know, utopia is a word that's kind of thrown around, and maybe not quite utopian, but maybe a society where everybody's happy. You know your neighbors, you say hi to your neighbors instead of hiding and kind of closing the door real quick so you don't have to have a conversation with somebody. A society of more togetherness, a society where everybody lives to 100 years old like they do in, you know, some of the blue zones around, where they're happy, they feel fulfilled, and they have a purpose more than anything. And connecting to that purpose is about having a healthy brain and knowing that everything's going to be okay. And I think spinal health is the first conduit to get there. I think the greatest risk with people not using chiropractic, honestly, I think we're already seeing it. You've got over 400,000 kids under the age of 12 on antidepressants. You've got kids that are suffering in school. You've got suicide being cool. And all the while their posture is weakening. We see more kids with low tone, lower spinal tone, decreased movement in the spine, and we're seeing it in increased numbers in autism and all of those things. Now, don't get me wrong, a lot of those things are multifactorial, but it starts with brain health. And brain health starts with spinal movement and starts with good posture.
If nothing changes in this world and people keep living this reactive life where they start waiting for pain to show up before they see a chiropractor, they wait until they have heart disease before they start eating better, they wait until they have diabetes before they get off of sugar, we're gonna keep going the whole faster. Being in my mid-30s, I'm seeing a lot of people in today's world who are my age who look and act like they're in their 50s and 60s because of the poor quality decisions that they made for their health when they were younger. And if that keeps happening with excess usage of technology, terrible diet patterns, lack of exercise, poor sleep habits, it's just gonna get worse. And this society that we live in is gonna be more unsafe as the years go on, of kids on more medicine, kids on more antidepressants, and more issues that you see in the news. You're gonna start seeing more of those situations show up. And that's not the world that I'm willing to live in, and the world I'm allowing my kids to grow up in.
So if you're a crisis-motivated person and you're waiting for the bomb to drop on your life, I'm gonna give you an advance notice bomb. Go visit some nursing homes, drive around your community and drive into some assisted living centers and drive into some nursing homes and walk in and smell the smells. Look at the people, these beautiful people who are trapped in these bodies, who maybe all along they were doing things that were not good for them, killing themselves, drugging themselves, medicating themselves, eating unhealthy foods, not doing the things that were good for them, and now they're trapped. This is your destiny if you're waiting for a crisis.
People really don't take personal responsibility for their health. Each of us are responsible for what we put into our minds, what we put into our mouths, how we take care of our bodies. And that's what we need to change in this culture. When people start to understand that it's not the insurance company that's going to get you healthy, that you must make wise decisions to get yourself healthy and to keep yourself healthy, and that insurance exists in case of a crisis. I mean, God forbid I should be, driving down the freeway and I get T-boned and I have a broken leg. I'm going to need a great orthopedic surgeon to fix that broken leg. But at the end of the day, the surgeon is going to splint it up or bolt it up, do whatever it is they need to do. And what's he going to do or she going to do with me? They're going to let me rest so that my body taps into its innate mechanism of self-healing. I mean, even a surgeon knows that he or she doesn't do the healing. I would tell humanity, number one, be responsible. Number two, we know without a doubt that the nervous system is the master system of the human body. It controls everything from brain cell down to tissue cell. Make sure you get your spine and nervous system checked by a chiropractor on a regular basis. Have a chiropractor that takes care of you. And the third thing, teach that, experience it, and then teach it to everybody you know.
My biggest thing, I think, for a solution for people to figure things out is we've all got to take responsibility for our own health. That's the first thing. We can never put our health into somebody else's hands. So if you think it's going to be your doctor that's going to heal you, whether it's your medical doctor, whether it's your chiropractor, you've got to take your own responsibility first. Second, start doing your own research. Start digging into what some of the side effects are. Start digging in to see how things are happening and why whatever that you're taking is ending up that way. Is the drug that you're taking even written for what you're taking it for, right? Or is it being off-labeled on something else? Like, start digging and start taking action, because as I tell every single one of our patients, every decision you make today impacts the quality of your life 10, 20, 30, 40 years down the road. And so unfortunately, we have a generation of people that are 90 and 100 years old right now, and they're decrepit in nursing homes because they outlived their life expectancy rate. They never intended to live that long, and now their health is not good, right? We're getting the advanced knowledge. So do you want to be decrepit at 90, or do you want to be healthy and active at 90? You have the opportunity to literally change the course of your life, and it just begins today with that first decision.
If I had a dog and I took it to the vet and it had bald spots and rashes, and it was getting lame in one hip, and it didn't have any energy, and it was snoring at night. And so I brought it to the vet and said, what's wrong with my dog? In the course of the intake, they're going to ask me about what I feed the dog. Well, let's say, for example, I tell them, well, rabbit chow was a lot cheaper at the feed store last month. So for a while, I've just been feeding the dog rabbit chow because it saves me a couple bucks. One of the first things the vet's going to say is let's move your dog back to a canine diet because rabbits and dogs have different nutritional needs. And when the vet would expect when you move that dog back to a canine diet, that at least some of those issues would disappear. We're not eating a human diet anymore.
I mean, just drive down the main street of any city or small town in North America, and it's fast foods all the way down. People aren't putting good in. People need to start realizing that whatever you put in is what your body then uses to make the new cells as your body recreates itself, depending on what tissue, every week, every day, every 6 weeks, every 6 months. If you want good tissues to be reproduced, you've got to put good in.
Our genetics want an omnivorous diet. It varies from time to time. Sometimes it's heavier on the meat, sometimes it's heavier on the veggies. Sometimes there are sugars in it, sometimes there aren't. Sometimes we fast, sometimes we eat a lot. That's what we were built for. We were not built to eat the same plastic industrial junk day in and day out without any breaks. Most of the food we have now, we were never intended to eat in the first place. Fruits and vegetables have been hybridized to be bigger and sweeter and fancier than they ever were in the past. Compare a pink lady apple to a crab apple, right? That's the apple we used to eat, was the crab apple. Not this big, super sweet, delicious, one. I love them too. But that's not what we were genetically designed for. And that's leading us into trouble. We're eating a diet that is addictive, hyper palatable, devoid of nutrients, and loaded with chemicals.
Just start with a few simple changes. Number one, just change your diet a little bit. Start eating real food. That's the biggest thing. And if you can't change your whole diet, just change breakfast. Think about this. If you start doing a superfood smoothie for breakfast for you and your family, 3 ingredients, either coconut or almond milk, berries, and a little bit of collagen in a smoothie, you just changed a third of your diet there. So that's step one. Make just small changes in your diet. And step number 2, make sure you have a natural or holistic physician on your side. You can make these small, healthy diet changes of eating real food, and you can get a natural physician like a chiropractor on your side. It's going to go a long way in helping you get healthy. So a lot of people don't realize how powerful a chiropractic adjustment can be for helping somebody overcome every illness from asthma to respiratory issues to digestive issues, even to the common cold or flu. Think about this. Your brain sends signals to all of your immune organs on how to function. And I can tell you, I've taken care of so many kids over the years and adults. They come in with a cold and flu. They'll get a chiropractic adjustment. And these people will realize or notice that now their sinuses are working better. Their lungs are working better. Their entire immune system is functioning at the highest level possible. And so that's critical, that when somebody is sick from everything, in my opinion, from the common cold to diabetes, to heart disease, to hormonal related issues and digestive issues, they should first go out and seek a natural practitioner. And today, our conventional medical system is really designed for one thing, and that's emergency care. If somebody's in emergency, if somebody is in a car accident, we have the best emergency medical system in the world, but that's when we should be seeking out our conventional medical system today.
We've seen kids who autistic children who are labeled with autism, who were nonverbal, who can speak again. We've seen kids who have been on all kinds of ADHD medications get off of these things. We've seen, and adults the same way. We had one adult who was on the spectrum and was painfully shy and not really doing as well in his classes, and now he's doing so much better, and he's taking photography classes and really getting out there and kind of pushing himself in a way he never did before. So there's always a chance for a child or an adult to change because of the idea of neuroplasticity.
There was one study that came out in 2007 that actually showed two groups. One group had a chiropractor as their primary care doctor, one that they went to frequently for things that would come up. Another group that went to the medical doctor primarily. And they measured, they followed these two groups of people, and then after a certain period of time, they looked at the results in terms of what are their numbers look like. The group that considered the chiropractor as their primary source of problems that they would see on a regular basis had 62% less surgeries, 59% less missed work days. They had 60% less visits into a hospital. And the most astonishing was they had 85% less pharmaceutical costs. So the people that saw a chiropractor on a regular basis compared to those who saw a medical doctor had 85% less pharmaceutical costs. This is the stuff that gets excited, because we now know then if we could start to get this information to more people, that could change the fabric of an entire culture.
If you see smoke from a mile away and the fire department showed up to address the smoke, if you just filter it and fan it and blow it, what happens to the fire? It rages. You gave it more of an opening. And in a lot of ways, that's what we do with our approach to patients. We say that in acid reflux, the acid is the problem. So what do? We use medicines that cripple our acid pumps. Not many people are really asking, like, well, why is the acid there in the first place? And so the symptom that brings people to seek care is actually usually the least of their worries.
The challenge that I think our country is having and parents are having is that they are treating the effects and not looking at the causes. I mean, it's not enough to just have our kids just be great for an hour or two in a classroom because we're medicating them. What is the effect of that their entire life? If they become addicted or if their body becomes dependent in some way, shape, or form. Young spines are degenerating, and we are masking the symptoms with drugs. We are masking the symptoms with medications. What does that mean for that child? What does that mean for an adult who just masks the symptoms, the pains, the discomfort with medications? It means that the habits, the actions, the lifestyle that that person is living, which is being covered up, is causing increased decay in the areas that are decaying. It speeds the deterioration. It's time we listen to our bodies and get to the underlying cause.
In medicine, we're always taught, okay, you have this pain or you have this fever, just use this medication. But you have to ask yourself, why is the body so inflamed? Why are they going through all this extra stress? Or why are they having this pain attack or this excessive migraine or whatever? Maybe it's a stress. Maybe it's something that could have happened, or they could have had a stress or some type of emotional event in their life in the last 2 or 3 weeks. And you have to, when you treat an individual or treat families, you have to look at a whole body approach.
The spine can become misaligned. It can stop moving appropriately. And when it does that, it creates an interference in the nervous system. And that may be a day-old baby, it may be a 15-year-old person out of a car accident, it may be just a person that's under stress for 20, 30, 40 years, maybe someone that works at a job that looks at their phone every day. These stress accumulates, and then unfortunately, they end up getting a symptom, and they go to the trusted person in their community that they've been taught is where the health comes from, and that is usually a medical doctor. And then that starts that cascade of a diagnosis, a prescription, another diagnosis, and so on. And so what we're saying is, if you understood from the get-go that your spine has stress, and the more stress it accumulates, it can create a problem, not just with the spine, but with all aspects of health because of that interrelationship with the brain.
We've introduced a chair. We've introduced a car seat. We've introduced a Texas-sized lounger, if you will. And we've simply become more sedentary. The research is just now coming out that sitting now is defined as the new smoking. Now, years ago, no one really thought smoking was harmful. Today, we know otherwise. It's really hard for me to fathom that sitting in a chair with my feet propped up is harmful, because it feels so good. But the answer behind all that is that most of the things that do feel good aren't good for us. We simply sit too much. We're not as active as we need to be. In today's world, it may be that the person's day-to-day activities are very narrow, very myopic, very focused in just a sagittal plane. So there's not much movement from side to side. There's not much movement in our shoulders. There's not much movement in our hips. And you don't have to go very far to see the number of people, adults especially, that are suffering shoulder problems and hip problems. They're being replaced now we have complete and total shoulder replacement. There's a reason why we have breaks. The typical hour is 50 minutes with a 10-minute break. Well, the idea is to get up and move around. People today don't leave their office very well or their desk for lunch break. In school today, children's lunches oftentimes are only 20 minutes. They can't talk to each other and they can't go outside. So we've really compromised the physical engagement of each other. And by doing that, we have sacrificed the tone of our spine, which as chiropractors leads a whole lot of people out there which are now subluxated. But we have more children, we have more people going to therapy, going to rehab, and we kind of need to bring back the element of play. Families need to ride their bikes together. Families need to go to the parks. We have cities that are doing phenomenal work on improving green spaces, though we're not getting the people there. And we're in a world right now where people admit to you that they are stressed out, they're overwhelmed, and there's no time for anything else. But yet, exercise has been shown to be as effective, if not even more effective, than most medications for blood pressure, for ADHD, for mental illness.
Like if you look at statistics, just right now, there is more proof that if you just went out and walked today, that there is better results in just walking and exercising than any pharmaceutical trial ever done on any drug ever for depression. In fact, if you look at the studies, there's actually never been studies done for very long at all.
We all know that different things, diet and exercise, definitely work. Unfortunately, we live in a society where we want that quick fix, right? We don't want to have to do the hard work. Everybody wants to be skinny and they want to be beautiful and they want to be healthy, but nobody is willing to take the steps to get there. And if somebody's promising them that they can have this magic potion and this pill, then why wouldn't they do that?
There are alternative or natural practitioners that would absolutely throw the baby out with the bathwater when it comes to conventional medicine. And obviously there are medical practitioners that would do the same in the other direction, because that's what they were taught in medical school. These are a bunch of, hippies that smoke pot and throw crystals and do a little something on the side, right? And that's unfortunate, because there is a massive amount of science involved in functional approaches, nutritional approaches, and natural approaches. And a massive amount of logic really involved in that. So what does the perfect world look like? What's the perfect situation for a person to get medical care for chronic illness? In order for someone to get the care they need for a chronic illness, there needs to be cooperation or mesh, a functional approach with a conventional approach, where, for example, they may put you on a medication until the functional doctor figures out what the underlying problem is, and then they can back you off the medication. That's the best case scenario. How you arrive at that, I don't know. And I say that because there's money involved. And when there's money involved, everybody gets territorial. You've got an entire system of healthcare bubbling under the surface here that is ready and willing to step up and really do a lot of the heavy lifting in getting us healthy again, so that we don't need as much of the acute care. But if I'm in the pharmaceutical business, I don't necessarily want that.
Everyone needs a medical doctor, everyone needs a chiropractor, and what the MDs and DCs need to do is work together to help these patients get what they need. And so a lot of patients will go see their medical doctor, let's say they have back pain or their child is sick. That's a great place to start. And then a medical doctor, if they can't help them with medicine should refer to a chiropractor to see, like, okay, maybe the chiropractor can help with that pain or just keeping the spine healthy.
So spinal degeneration, I think, is something that doesn't just happen when you're old. That's an old thought process. Now we realize, I've seen kids in their teens already have the beginnings of spinal degeneration, especially if you were in a bad car accident or you're playing some high impact sport like football, wrestling, something like that. So one of the things that my thinking is because of this, sitting on their phones for hours and hours and hours on end.
Children who are under chiropractic care typically aren't as sick as often as other kids who are not. So a lot of issues that are going on with our society. Kids are having ear infections, asthma, allergies, things that we weren't having issues with 10 years ago, 20 years ago. Also, they're not crawling, and so they're not really developing properly. They're going right from like scooting and then walking, and they're missing a whole milestone, which is really causing a decrease in brain development. They need that motion, they need that cross-crawl sort of motion in their body, and so they're missing a whole step. They might have something off in their spine, which is causing a tight muscle, which isn't allowing them to crawl properly, or it's uncomfortable. So it's more comfortable to do like a scoot or just go to walking. But if we can, again, address those tight muscles and the subluxations, they're able to move their body the way that they're meant to move and develop properly.
By the age of 2, a child should have a 32-degree curve. Not too long ago, I had a 9-year-old with a 27-degree reverse curve at the age of 9. Now, every clinician out there knows what's going to happen if we don't intervene. The key to things is in the prevention model. Now the time is to raise the message of awareness of, hey, get your spine checked. You get your teeth cleaned. You get your hair checked. You go to your doctor for your annual physical. Now we need to raise the message, hey, your spine, you've only got one. Now's the time to raise awareness of what spinal health is all about and make a movement in preventing spinal degeneration. There is a natural S configuration to the spine, and that configuration allows us to have a certain spring. So the old adage that you might have heard from grandma and grandpa was, so-and-so's got a spring to their step. Absolutely right. We have an arch in our feet, we have a bend to our knees, we have a curve to our spine that allows us to walk and it allows us to absorb energy. And so as we move through Earth, if you will, with gravity pulling down on us, it allows us to kind of act like a spring. When we tuck our head forward, when we lose tone of our muscles, then the spine begins to degenerate. And believe it or not, that's actually a natural process for the spine in an adverse environment. That's the difficulty. So the spine is saying, hey, if you're not going to move side to side, then I'm going to start to fuse everything in this sagittal plane. And so now we see pain, we see bone spurs, we see pain down an arm or down a leg. We see a variety of musculoskeletal complaints with neurologic types of pain under the guise of cervical or spinal spondylosis or spondylomyelopathy, and a whole variety of medical terms, if you will, that to the average person says, hey, I hurt.
What happens is, if I start to lose this advantage over gravity by having a spring-like system in my body that was designed like that, if it starts to straighten out, then what ends up happening is I put more pressure on a couple different areas of the spine. Okay? This is where you'll see like x-rays. Look at the discs at the top of a neck. Almost across the board, you will never see big, massive degenerative changes in disc in the upper part of the neck. But in the middle part of the neck, C5, C6, C4, C5, C6, it almost invariably wears out.
The way our spine has been designed is to allow us for the most possible movement. However, with the increase in flexibility, you also have an increase in vulnerability. So when you're more vulnerable, now you're going to have potential issues of injury. And I don't just mean injury like a trauma injury. I mean like repetitive injuries, sort of like if your kid's texting all the time like this, keeping your head down for hours at a time is an injury, but it's a slow injury, so it's a repetitive injury versus a quick injury like a car accident or a football. What these repetitive injuries do is they will take the spinal curves and they will change them. So instead of them being a nice forward curve like this, they will straighten up, or in some cases in the neck, they'll actually have a reverse curve. And it has been shown in studies that people who have necks that are straight or necks that are reversed have a lot more potential problems than people who have a nice forward curve.
For me, chiropractic is about lifestyle, maintaining that. In fact, do you know when the most important time to get adjusted is? The most important time is when you have no symptoms at all. So did you keep it that way? Right? So you maintain a spine for a lifetime, not just so that my spine doesn't break down and degenerate, so that all the nerves that exit that spine into every single organ maintain every single organ and every system and every function, so that through all of that, guess what? You get life to the full 100%.
A lot of people that are already healthy, I just ask them questions. Could you be more? What are you lacking right now that you don't have? Is there anything else that you feel like you need to be fulfilled with your health? Right? Are you an athlete? Are you trying to prevent injuries? You know, you just start to ask them all these questions and you start to learn, oh yeah, you know, I just feel like I sit down at my job too much, my back has started to bother me. Or, you know, I love to play soccer and I've been missing my goals lately. And you go into the conversation about optimization between the brain and the body, or you ask them, hey, would you like a natural drug-free approach to help your body perform better? And those are the types of people who are going to be like, yeah, actually I do.
So let's talk about safety. And what is safe when it comes to healthcare? So one of the things in healthcare that we judge safetiness is what is the risk insurance-wise, right? Like think about a car. So I drive a Porsche. There's a lot of risk in a Porsche. You can go really fast. There's also risk of theft, right? So the risk is then born in that my insurance rates are higher than on a different vehicle, right? So in chiropractic, if you look at safety, if we were risky to society, that would be reflected in our malpractice rates. Our malpractice insurance, when I was in practice for myself and 2 associates, was less than $4,000 a year. So what does the insurance company say? You guys aren't risky. Now, compare that to an obstetrician, a neurosurgeon, or even a general practitioner. Their malpractice rates are out of this world, and that's also why we see most in the medical profession are in group businesses, or in group practices, or practice under a hospital's umbrella, because now that risk is borne among a lot of people instead of just individually. So when it comes to safety, here's what I would encourage you to do. Number 1, find a chiropractor who's trained to adjust children. Then secondarily, pick up the phone and call them. Go and check it out. Again, do your research and find the doctor that you're comfortable with. Ask questions. As a chiropractor, we love, trust me, we love to educate. We love to prove to you what's wrong and how we're going to make that correction. So at least why start? Take that first step, go and get checked. The worst thing that could happen is you'll be smarter.